Hello, my name is Dr. Mo Hossain. I'm a GP in the UK. Thank you for watching this short 5-minute video on the NEPTUNE consultation template. The idea of this template is simple: to copy and paste the history and examination findings, and then the treatment or management of the patient into sections of the clinical computer system, such as EMIS or SYSTEMONE or Vision, for good and fast and efficient medical record keeping, and then to edit the text as needed. One can copy whole paragraphs or blocks of text at a time of medical and scientific and technical advice quickly and efficiently. As we all know as doctors and nurses, it is important to record the negative symptoms and signs into the clinical record to help protect ourselves legally. This template has an original GP focus but can be used by hospital colleagues in a similar way just as well, for example by hospital doctors, physician associates, advanced nurse practitioners, clinical pharmacists, and of course GP staff. I'll just show how the template is used. Please note the copyright notice at the top of every page and the email address on line 3 at neptunedocs1@gmail.com. That's neptunedocs1@gmail.com. For all enquiries, that's the email address. So I'll just scroll down to the section here for general history taking. So one just highlights the relevant section and then copies and pastes that text into the clinical record. Importantly here it states that the clinician has reviewed the past medical history and medication and allergies. I think these are all important things to write down in the medical record. Then, for example, scrolling further down the page, the general examination section, general physical examination, one just screen, then copies and pastes this whole section into the clinical record. Importantly, it states here in this section that the clinician has observed no anemia, clubbing, stridor, respiratory distress, etc. So these are all important things to write down as negative symptoms and signs. So that's how the template is used. This template has an Adobe.pdf version at present. It has been used for the past 10 years myself, and as explained, it's useful for GPs and hospital colleagues also to write excellent medical records. I'll just go through the sections now. So as you'll see here on screen, there's a general patient history taking section, which I've just mentioned and shown. There's a general physical examination section, a section of administrative comments here, then medications advice section, going down, healthy lifestyle, diet, exercise and sleep advice, etc. This is really useful because one doesn't have to write the same advice again and again and again for every patient. One just copies and pastes the excellent wording into the clinical record and then edits it as needed. Next, a section abdominal history and examination. Next, section cardiovascular and respiratory history and examination. Then a referrals advice section. Then a psychiatric or mental health advice section. Next, musculoskeletal or MSK and orthopedic advice section. Then a section on elderly care and advice. A section on common eye problems in general practice and advice. Common ear problems in general practice and advice. Then a skin health section for dermatology conditions. Then a section on minor surgery injections done in general practice. Then a postnatal template and a 6-week baby check template relevant for general practice. Then a section on gynecology and HRT and contraceptive pill advice. Then a section on pregnancy advice. A section on diabetes advice, risks and dangers of diabetes, etc. Then a DVLA or PSV, that's public service vehicle, physical examination template. Then a fostering examination template for UK County Council fostering reports. Then a section for dementia review, anemia, comments and review, and assistance review, etc. So there's a wide range of practical uses for different scenarios. Let's go to the top of the page again. So there are four big benefits from using this template. Number one, this template speeds up data entry by about 500%. So in 5 minutes, a doctor or nurse can write fivefold more clinical, technical, and scientific medical records. This helps to protect the staff member and the clinic and the hospital from complaints and legal prosecutions. So this is a great tool for increasing productivity. Secondly, the wording in the sections acts as a memory aid to help write excellent medical records. Thirdly, there is no need to write the same healthy diet and exercise and sleep advice again and again and again for every patient. Just copy and paste the excellent wording and then edit it as needed. This saves a lot of time and effort. Fourthly, as the UK NHS pays out, I think, about £21 billion per year in medical legal cases, this template will help to reduce this cost. It was originally created for Neptune Docs Limited by myself and may eventually be marketed by other companies and in other countries. There was an article by Victoria Atkins, who is the UK NHS Health Secretary and a barrister, in the Saturday Times on page 23 on 2nd December 23, saying that the NHS is keen on using new IT and computer templates to improve UK NHS productivity and efficiency. In that same newspaper, on that same day, on page 36 to 37, there was also an article about new technologies to improve and revolutionize the NHS. So this Neptune consultation template will help to do just that. The email address for enquiries and for orders is on the third line down here. As email is neptunedocs1@gmail.com. That neptunedocs1@gmail.com. Thank you so much for your time and for listening. Goodbye for now.